Now we are live, ma. So, assalamu alaikum wa rahmatullahi wa barakatuh, everyone. Today, inshallah, we will have the third phase of our 5 days online webinar. So, hosted by Fonte University Medical Laboratory Science Department in collaboration with the Mesa Southwest region. And today we have on our live session one of our respected medical laboratory scientists, MLSCT Anifuoshi Amina. And I bet you all, I promise you all, you'll be enjoying the session as she is a very, very experienced medical laboratory science. So now we'll be starting the session fully. I think you can start, ma.
Good evening, everyone. I am Amina Nifurushi. I'm currently a prospective core member. Recently finished my internship at Hospital Management Board, Ashibua Oshiki. And today I'll be taking the topic titled From Student to Skill, Navigating MLS Prospects. And I'll be dwelling based on data analysis as data analysis in medical laboratory science. I believe, or let me know if I believe, some of us as students, when we go to posting and we see how things are happening, sometimes we think to ourselves that, is this really what MLS is all about? Like, am I going to be doing lab work for the rest of my life? Am I just going to be coming to the lab, processing samples every day, same routine every day? Well, I want to use this opportunity to let you know that in life, if you are doing what everybody is doing, you tend to like limit yourself to a lot of things, tend to limit yourself to opportunities if you are doing what everybody is doing. The only thing that will make you stand out is doing something different from what everybody is doing. And one of the ways you can do that as a medical laboratory science student, like you can start building the skill now, is trying to dive into various branches of MLS, and which we have actually been exposed to in our various courses, and which we're going to know during the course of my lecture. So now, since I'm currently into data analysis, I'm going to be dwelling more on that in relationship with our background knowledge, which is MLS. So now, first of all, what is data analysis? It simply involves about like 4 to 5 major steps, which involve the processing of data. And this data could involve a primary source or a secondary source. For a primary source, it involve you taking the data directly from the main source. In terms of our profession, for those who are research students, you are most likely to collect your data directly from your patients. So that source data is called a primary data. But for a secondary data, it's a data that you collect from a secondary source. And this secondary source includes taking the data from a database such as NCBI. NCBI is National Center for Biotechnology. NC Biotechnology, I can't remember what the I is. So that database include all genetic information of any like any organism, any any biological data at all is inside that database. So if you want it, you can easily extract it. So that is an example of a secondary database. I mean a secondary source of data. Another source of data is you as a researcher, instead of you meeting the patient directly to collect their sample, you just go to a laboratory that stores their data properly and retrieve their data from, it could be from their database or from their record. So like I said, data analysis number one involve processing of collected data. So the processing could involve the processing will involve transforming this data. So under the transformation of this data, we have cleaning of data, we have validating this data. Cleaning of data is removing duplicates, trying to check if okay, all the information there are correct. Are they duplicates? Are they missing values, spelling errors, and all? Then after we have transformed this data, we have validated, we are going to draw models. So now these models will give us what we call valuable insights. These models will include dashboard, and this dashboard will give us solution. Okay, why is there um an increase in diabetes in this particular region? Is it because of their lifestyle? Or take for example, in the east of Nigeria, they are known to be alcoholic. There's not how you will meet an Igbo, or you go to any Igbo gathering, you won't see them taking alcohol. Like big, they are always drinking, be it the normal beer, normal palm wine. They must drink in whatever garden. But compare that drinking habit to the northerners. Though there might be people that drink there, but you can't compare their drinking habits to those in the east. So now, those data that you have gathered will give you an insight to okay, um, will give you an insight to solutions you can get from those data, and this help us to support informed making to help us know okay, what is the next step for us to take in terms of, let me use malaria for example now, or let me use a what maybe waterborne disease and all. Since you guys are since you are in continent in Osun State, and Osun is like a waterborne area. So and there are some areas in Osun State that they still drink from their river. So this river now, they could have parasites, and this parasite could be schistosoma, all these waterborne diseases. So now you can derive information from all those things, like be it their lifestyle, be it their environment. You can derive information that okay, maybe because of this water, what are we going to put in place? Probably to install a water reservoir for that community, a borehole. So basically, that's like an overview of data analysis. And we should also know that in data analysis we have four type of data analysis. We have the descriptive data analysis. This is where we question what happened then diagnostic data analysis is why did it happen. Then we have the predictive data analysis, is what will happen if we go through this channel. Then we now have the prescriptive data analysis, is okay, what are the solutions, what solutions can we take from this analysis that we have done. So now we already have like an insight of what data analysis is all about. Now, as medical laboratory science students or scientists, this little knowledge can be infused with our background knowledge, and from the little data I gathered, this can be applied in our quality management, quality assurance and control, supply chain management, and disease prevention and control. So for quality management that we have been exposed to, it's basically a structured framework that defines and documents an organization process, procedure, and responsibility for achieving quality policies, practices, and objectives. And the main goal for QMS, which is quality management system, is to reduce waste, increase efficiency, and improve customer satisfaction. Now, you can't obviously do this without data. You have to have a data where you're keeping record, and where you're monitoring probably the inflow of things and all. So in quality management system, um Um, like the application of data analysis in quality management system involve organizing, controlling, maintaining the flow of information throughout all processes. And all this can be automated in data analysis. So we have a way of doing it. Even ordinary Excel can do that for you through with data validation. You can also build like an automatic and interactive dashboard which help you like update data, and you'll be able to see the trend or pattern of how your processing is. So that's for quality management system. So for quality assurance, this is the proactive management of processing design to prevent defects, ensure that products or services meet established quality standard. And we have, before now, we know that we have three phases. We have the pre-analytical phase, analytical phase, post-analytical phase. And in the laboratory, our pre-analytical phase involve proper sampling, labeling, correct specimen collection, labeling, and secure transportation. Now we can still use data analysis in this. There's the way you the in standard laboratories, there's a way they do, like, should I say, let me call it data validation, because that's what we call it in data analysis too. Let's say a patient number, a patient in standard laboratory that uses what they call this one, electronic monitoring record, also EMR. I don't know that electronic monitor medical record. Now, for every patient that come, there's always a unique number assigned to that patient. So if you have such system, there's no how this is going to reduce errors that is going to happen in pre-analytical phase. For example, Mr. Ojo is coming. As Mr. Ojo is coming, I'm inputting Mr. Ojo's details and I'm assigning a unique number to this Mr. Ojo. Before it gets to the lab, we're going to ensure that this Mr. Ojo's Mr. Ojo specimen, everything about Mr. Ojo specimen relates with the information on that unique number that is assigned to Mr. Ojo. Now, for the analytical phase, this one is basically in the lab checking if the equipment are calibrated, the testing method are validated and strictly adhering to SOP. Then for the post-analytical phase, it involves following test procedure, verifying if the final data is correct, reviewing transcriptional measures, and accurately reporting results to physicians, researchers, and regulatory body. Now, the importance of data analysis in quality assurance is that it helps in giving out real-time monitoring and alerts. So in a system where you have everything working well, there's a way that if there's going to be an error, it's going to like notify you that, oh, this thing is incorrect, or this, okay, let's even take for example our normal machine. When I was in Uniosun, there was this particular machine that we had in micro. Now that machine is an automated blood culture system. So what that machine does, I don't know if we have other people from other school, or I believe Fountain, I don't know if the culture system is still working. If it's still working, I believe Fountain students and students that do their posting in Uniosun will have seen how that machine work. So basically, what that system does is that after you, that system is a perfect example of how data analysis work in the laboratory. Now, that each bottle come with their unique barcode. And I think you're going to impute the laboratory number. I cannot really remember. Now, once I've imputed the barcode, it's going to scan the barcode, and you're probably going to impute the laboratory number to that bottle. We're going to place it. Now, once it's observed that there's growth, I mean, not growth, there's presence of bacteria, it's going to like flag it that it's going to make a sound, give you an alarm that, oh, this particular this thing has bacteria, come and remove it. So this is an example of real-time monitoring and alert. And if there's no bacteria present in it, it's also going to notify that no bacteria present. Then another thing is another application of data analysis in quality assurance is root cause analysis. It helps us to know, okay, the exact cause of a reoccurring or error or sample contamination. Then we also have predictive analysis. There are times that there are some machines now these days. If there's going to be maybe there's a blockage in the machine, or maybe the machine is hot, like it's going to notify you. Or let's say the reagent of what you're using is about to finish, it's going to inform you that, okay, this is about to finish, or there's a blockage in it or something. So that's one of the ways data analysis too is being applied in quality assurance. Then the next thing is quality control. That one involves the daily monitoring processes like calibration and testing control sample to verify the accuracy of tests. And we can see that using trend identification. After we have controlled like a particular sample, we can see the trend in which the instrument is able to perform over time. Then we also have method validation. This helps to test method, equipment, or reagents that meet required performance standard. Then we also have processing optimization. So we can use a tool called Six Sigma to measure process performance and reduce variability in analysis. Then another aspect in which data analysis is used is what we call the laboratory information management system. So there are some laboratories that automate their data collection. Instead of our normal, okay, bring your form, everything is being documented on a system, and this enforces data validation automatically and ensures that there's compliance through secure audit trails. Then we also have another aspect called supply chain management. Basically, this involves collection and procurement of reagents and sales data. So if you have this knowledge of supply chain management and you're also a data analysis, you can help minimize costs, prevent stockouts, and also transform raw historical figures into actionable insights. For example, you work in a laboratory, or you are currently posted in record. I don't know if they post students to record units or inventory or store. So let's say you are posted to the store now, because there are a lot of time where I did my internship, there are a lot of time that maybe because we don't have access to the information of, okay, if the main stock is available, our own is just go there, request for it and use. So we don't have access to, oh, is so reagents available, or is it going to finish anytime soon? We just come one day, ask for a particular reagent, and at the end of the day, we observe that this reagent is finished. And with this, our patients, we'll have to tell our patients to probably come tomorrow, or even give them a far date that we're not even sure if it's going to be available or not. So if you are a data analysis and you have your knowledge of supply chain is very, very strong, you can create an automatic pipeline in which, okay, if there's going to be, you can create an inventory system whereby if GIMSA is going to, let me not use GIMSA, let me use a reagent like body strip test, RGT. If PT, you were supplied 100 packs of PT strip from a particular vendor. Let's say the vendor's name is Randox. Just an example. Randox supply 100 PT strip to Shaw Lab, and as someone, probably you are the supply chain manager of that particular place, or you happen to work in the supply chain management section. Now you can create an inventory system whereby for every what's the word, for every time any scientist or anybody comes to collect that strip, the the numbers are automatically deducted. Then you can also create something in such a way that once you get to this limit, it's going to give you a notification that, let's say you retrieve, you got 100. You can set it in such a way that once it gets to 20, it should notify you that you should restock. So that's one way you can apply your data analysis. Then it also demand, you can also use it to demand forecasting, like what I said, for you to know when to restock instead of waiting for when all your reagents has finished. And in the lab, once there's no reagents, there's no work. Once there's no consumable, imagine when you go to a laboratory and they're telling you there's no syringe. It's more like a farmer going to the farm without hole, or if the person is doing mechanized farming without tractor, what are you going there to do? Basically nothing. So you can use it to prevent you from delays of your goods. For those in the laboratory business, they know that you always have to be, your reagents have to always be in stock. You can't tell patient that, oh, we don't have this reagent, oh, we don't have this. It reduces your trust and reliability, because if you are dealing in laboratory business, your patients are actually your customers. So, and you have competitors outside. Then in supply chain, you can also use it to analyze transport data, optimize dispatch and minimize freight cost. So ways you can use it to analyze transport data, we have fuel usage, transmit time, and delivery routes. Then you can use it to check for risk management, to know which supplier, evaluate supplier lead time and financial health to identify potential bottleneck before they disrupt the entire production line. So the next one is disease control and prevention. Currently, there is an outbreak of antivirus, right? So, and for disease control and prevention, it helps to minimize the spread, the duration and impact of those infectious and control diseases. So we can use data analysis to track outbreak, then promote public hygiene, vaccination, and treat infected individuals. So application of this in data, in disease prevention and control is surveillance and anomaly detection. So analysts use electronic health record, lab results, and even unstructured data for spike in syndromic trend to catch outbreak before they escalate. Then you can also use geographic information system analysis, mapping out the disease cluster to help identify environmental reservoir, demographic vulnerability. Then we also use predictive model to be able to know, okay, probably there's a change in season, vaccination rates, to forecast future waves of information, infection, and plan medical supply chain. So this predictive modeling, basically, this aspect is what data scientists use. So there's a the difference between a data analyst and a data scientist is majorly the tool they use. So a data scientist will be using more programming tool than a data analyst. So, and data scientists actually do more of the predictive modeling than a data analyst. So now, what is the importance of all this data analysis stuff that I've said so far in MLS? So we can use it to personalize and do precision medicine. So instead of us treating patients generally, you can use it to tailor your, because every patient is the thing about this data of a thing is that in Nigeria we don't really have the data culture. Even our data sef, you can imagine where you go for interview and before you, I don't know if this thing is real, but I'm sure I've seen meme of people going to submit their CV and before you know it, their CV is in one suya spot, selling suya spot, which is bad actually, because that is somebody's personal detail and you can use that to track the person. That's why if you are writing your CV, you are not expected to write your full address. If you are in Osun State, you can just write Osun State, Nigeria as your address. So, and it's very, very bad. We lack data. I don't. Should I call it data policy in Nigeria? So now, if the system is working, every patient is supposed to have a personalized data in which everything about the patient is there, both their genetic information, metabolic data, everything is in that data. And now it will help the clinician to tailor a particular treatment plan to that individual. Imagine where somebody is probably allergic or has GCPD deficiency now, and they want to recommend a malaria medicine. For anybody that is G6PD deficient, you cannot use chloroquine for such individual. So if we have this data culture now, and I go to any hospital, provided they are in the healthcare sector, they already have that data. So once they check my data and they already know that, oh, this person is allergic to so, the person has GCPD, it's going to help the clinician to tailor the treatment they want to give such individual. Instead of doing trial and error and before you know it, oh, this person is reacting, let's give the person something that will counteract the effect of what they have given them and all. So then it also enhances diagnostic accuracy. So it establishes a clear clinical cutoff and harmonized test reports. They will also have disease management and public health. So data analysis help us to analyze aggregate results and identify high-risk population, track diseases, and proactively management conditions. Then we have the quality assurance and standardization, which I've mentioned earlier, helps to internalize metrics, help to monitor error rates and validate quality control. Then we also have operational efficiency. So data analysis helps to track key performance indicator, which is KPI, and majority of time, laboratory KPI are usually our turnaround time, then test utilization. So it helps to optimize staffing, management equipment, and reduce overall health costs. So moving on, we have career opportunities as a data analyst. So the thing is, data analyst is just like a general name. So I felt like it is very, very important because there are some job opportunities that you might see. They won't say, oh, we're looking for a data analyst, but a different name. And if you don't know it, you will think you are probably not qualified. So we have a laboratory data analyst or a clinical data analyst. They will also have health informatic analyst, then epidemiology or data officer. Then we have quality assurance and control analyst, research/data analyst, and you can work in the university or research institute. Then we have monitoring and evaluation officer, which is also known as M&E officer. Then we have public health analysis. So for the epidemiology data analysis, epidemiology data analyst, monitoring and evaluation officer, public health, those ones are, you are most likely to work with NGOs, people that go for outreach, NGOs outreaches, people that need those data to for their research. Then for the quality assurance and control analyst laboratory, you're most likely to be confined in the lab or diagnostic companies. For the quality assurance and control analyst, we have some companies that model all this our equipment and all. They need if you are very good with your quality control and quality assurance, quality management system basically, and you're also a data analyst, they will need you. So we also have healthcare business data analysts. So for those who like business, you can dive into this because some laboratories are basically business. So and they will always want to know, okay, what are the ways we can improve our services and all. Then we also have the regulatory affairs data analyst. Then laboratory information informatics specialist. So now, who are those who need your service? As a data analyst working as a medical laboratory scientist, oh no, as a data analyst working in the medical laboratory science space. So we have clinical research organizations. So you can just search up for clinical research organizations, and there are many of them. Then we have public health foundations such as public health foundation. Then we have global health NGOs such as WHO, e-health. Then we have health tech and telemedicine companies. So there are some people that, example of telemedicine company is Reliance Health. We also have some insurance companies too that are diving into the telemedicine part, because insurance covers health too. So some of them are into telemedicine. So we have something Mansard, I can't remember. Then we have Leadway Insurance too. They do telemedicine. They also have healthcare consulting and implementation firm. So I guess this is where I'll be ending it. So if there are questions, and I hope what I said so far, nobody is confused. And if you are, I'll welcome questions. PR. Hello.
Question. You get back to this group. When you online, question.